ADEE has always been very engaged with the communication of education to our dental institutes across Europe and the central role of oral healthcare professionals. When the pandemic hit, we realized we would have to do a survey, and this was jointly with our oral health edu partners, Erasmus+. The survey was preliminarily published online in May 2020, open access. ADEE has always been at the heart of education, so we decided to initially to pilot our questionnaire with the Oral Health Edu Erasmus Plus partners and also the ADEE executive. We managed to get the survey completed by the 25th of March to send out to 153 European dental schools. The survey initially was from the 25th of March to the 5th of April, so it was only the immediate impact. 69 schools responded within this period of time, and we did get further responses which will be hopefully published later. There were 5 main areas of concern explored. At that time, we did not explore the issues of things like PPE and infection control because we knew that would vary from country to country and different countries would have different challenges. We focused primarily on the education, so it was clinical-based education, non-clinical teaching, assessment, well-being and pastoral care, and then the future implications. The clinical-based education from the initial survey showed that undergraduate care had basically stopped in Europe and that 96% of any care provided was emergency and was provided by senior qualified staff. It also gave that the countries were following their national guidance or directives, but were also looking for international organizations to give them guidance on where to go. Non-clinical teaching had been restricted with most schools closing. Online teaching became the norm with virtual meetings. Assessment was rapidly changed as well. 46% postponed all formative and 42% claimed they were postponing all summative. Clinical competence tests were basically stopped by 72%. Well-being and pastoral care was an issue, and 30% of the schools that responded said that their universities had not provided any COVID-19 specific support at this time. Most of the support that was provided in the universities that reported well-being were being managed centrally and not through the dental school. At this stage of the survey, which was just at the pandemic, as I said, from the 25th of March to the 5th of April, the long-term implications in dental education at this time were not clear. The dental academic institutes responded in an agile and innovative way. They responded with their online teaching and responded eventually with online examinations. We must remember that dental education is very different than medical education, and that a high proportion of dental clinical education requires students in physical settings, unlike medicine, which can use telehealth formats more easily. The examinations have been transformed to more simulation and more online with less patient contact. With the well-being, as Irina has mentioned, the demands of being ever present and being ever contactable, we need to be aware of, and the stresses that this may cause our students. We have not surveyed the mid and long-term implications. These were just the immediate responses. And the other speakers will discuss this in a few minutes. But we must remember that until a vaccine is developed, social distancing in some form will have a major impact in all our educational establishments. We must also remember that some of the impacts will be permanent and maybe for the better. You know, the amount of online teaching that we are doing and the amount of simulation, development of simulation may end up with better qualified students. It's important also that we collaborate with the wider healthcare team and the importance of the role of the dentists and the dental team in possibly managing things like vaccination programs, testing, etc. We must learn from this experience and remember the binding professional responsibility given by Hippocrates, and that is primum non nocere, first do no harm, and that is to either patients, students, or staff. We all need to look after each other in these challenging times. Thank you.